my name is Marcel Klötgen. I will talk shortly about the interoperability profiles for health data sharing. Okay, so as we have seen in the presentation before and especially in the video, the data was used in a specific treatment context. The doctor especially received information in a healthcare context about the patient, and also raised new data on his application. And this was presented in a specific format and language. Then we have seen that the patient also used a mobile device, which also presented data, but in another structure and language. And then these two applications also exchanged data. And since the data is stored and processed on the two devices and applications differently, the exchange of data requires a standardized structure and a standardized terminology in order to be used for a specific context. Thanks. And this is called semantic interoperability. And we implemented semantic interoperability in Interoperate with the use of H87 FHIR. FHIR is a standard by H87 International and presents different concepts. Especially FHIR provides a set of resources that represent specific clinical and administrative concepts. And these resources usually provide a structure and semantic for a lot of use cases. Next slide, please. And FHIR also, here we can see that the resources that H87 FHIR provides are structured in different categories. Next one, please. And these are the basic FHIR resources. Next slide, please. And here we can see the structure of a specific resource, which is called observation. The observation resource can be used for diagnosis, for example. Next slide, please. FHIR also provides the concept of profiles. A profile is based on a FHIR resource, and this FHIR resource is adapted to a very specific use case and context, by using constraints or extensions of the original resource. And in Interoperate, we have provided 43 profiles for our use cases and used 15 new extensions and 20 value sets. And therefore, we were able to provide data in different categories, for example, for emergency and summary data, for prescriptions, for laboratory results, for medical images, and reports, hospital discharge reports, demographic data, and last but not least, also consent and provenance data. Next slide, please. And please click again. Yeah, this is one profile, one example of a profile that we have provided. Here we can see our research study profile, which is used in the research scenario, which we will discuss later on. Next slide, please. Next one, please. Sorry. Please go on to the next slide. Thank you. And in Interoperate, sorry, can you go back one slide? In Interoperate, we also used the concept of implementation guides. Implementation guides provide the means to collect and aggregate FHIR profiles and value sets, also for a specific use case. So, for example, we provided an implementation guide for the use case we have seen before in the demonstrations. And these implementation guides also provide documentation of the profiles. And in Interoperate, we provided 2 implementation guides for our standardized profiles, thus addressing the cross-border data exchange scenarios, which we have seen, and the research data scenario, which Francesco already explained a little bit. Go on to the next slide, please. And now we can see our an example implementation guide, which we have created in Interoperate. This is the research data sharing implementation guide, which provides documentation. Go on, please. And another. And a list of fire profiles. Yeah, and in Interoperate, we will also try to standardize the implementation guides through a balloting process, which is orchestrated by HL7 Europe. Thank you very much. I'm at the end of my presentation. If there are any questions, we can discuss them, I guess, after the panel discussion. Thank you.